Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Well, hello again, Dr. Moya.
Hello, Brittany. I'm excited again.
I know you are. You're funny.
Thank you.
So today I want to talk about something that it shouldn't take too long, but it's kind of important for a lot of women. Big concern for women who have lost a lot of weight. It's an area that I don't think too many people are interested in talking about, or they're a little too nervous or shy. And that's the mons pubis region. Some have a little fullness left in that area. Some have a lot of skin. What options do you have for that weight loss woman?
I think it's a great topic. I always address the mons pubis when we start talking waistline contouring. And for most patients, it can be addressed with any kind of tummy tuck or body lift approach. First of all, let's talk about what is the mons pubis.
Right.
So the mons pubis is part of the vulva. It is the top part of the vulva. So basically, it's really where the hair-bearing skin is, the pubic hair. I mean, obviously, that can extend below that and around the labia majora, but for the most part, it's confined to the mons pubis. So the mons pubis is over the pubic symphysis, the pubic bone, which is part of the pelvis.
Okay.
So if you're pushing down on it, you feel this bone there. So that's the mons pubis. So I have found patients who have lost a lot of weight. That area can become saggy. It can drop, or some patients still have some fullness still in that area. So for the majority of patients who have loose skin, if it's loose skin in the mons pubis, any type of tummy procedure will address that. Why is that? Well, you have a lower abdominal incision, and as it gets pulled up, it's going to pull up the mons pubis. So the majority of patients I see have just loose skin that's extended from the tummy and affected the mons pubis.
Okay.
So it's not necessarily that it's loose skin in the mons pubis. It's that the whole front of the tummy has deflated and everything has fallen down.
Gotcha.
Which can also include the vulva. Vulva meaning the labia, the opening of the vagina, all that can actually fall down. So it's actually kind of too low. So by doing, let's just say tummy tuck, and we go low with our incision and we pull everything up, we're not only going to make the mons pubis look better, because now it doesn't look like it has loose skin, it can actually, in some patients, lift the entire vulva back into the right position. Yoo-hoo, woo-hoo for other patients. They're really happy.
Yes.
Now, there are other patients that truly have loose skin of the mons pubis after they lost weight. For those patients, we have to design the tummy procedure to address that skin. So from a tummy tuck to a corset body lift, it can be designed that way. So what we'll do is we will bring the lower abdominal incision into the mons pubis. So we'll actually remove maybe, let's say, 2 or 3 inches of that mons pubis and then lift it up.
Okay.
So that addresses that perfectly, but that has to be built into the procedure that's being used for the tummy. Now, there are some patients, if you do that, they actually have trapped fat even below that in the mons pubis. So those patients, we can actually take that fat out from under the skin.
How do you do that?
You
cut it out, liposuction?
No, we cut it out.
Okay.
Cutting out is better because it guarantees you get it all out.
Okay.
And then we want to tack that down. You don't want to just cut that out. Now you have like a potential space under there, and you're kind of leaving it there. You want to tack it down so you're not, now the mons pubis can be pulled up too high. And you don't want that. You want everything to look right. So what you do is you tack it down so that it gets pulled up appropriately, but then no more than that.
Okay.
And also there's no space under there.
Okay.
Now, the next thing would be, there are patients who have mons pubis skin, loose skin, that is not just up and down, it's side to side. And what does that look like? Well, they come in with a mons pubis that almost looks like a baseball or a grapefruit.
Okay.
I mean, it's pooching out. Those patients, you will not be able to get a good result alone by cutting into it. a few inches and lifting it up or getting rid of the fat. They're going to have loose skin still there, and it's side to side skin. So for those patients, I tend to do an up and down incision, like I do for a corset, an inner thigh tuck. Correct, a cinching procedure. So I can get rid of all that loose skin side to side, kind of pull it together, pinch it, get rid of it. Flattens the mons pubis. Sometimes with that, we also have to do a small transverse incision, a incision over the top, really just the top part of the vulvar commissure. It's where the labia majora come together, the clitoral hood. There's a small incision above that to flatten that if we're going to do an up and down incision, meaning it's the dog ear that we're removing.
Gotcha.
Those are all things that I will design for the patient when we come up with a plan, if that's an issue for them.
Right.
And sometimes that can be done at the same time. Sometimes it's best to stage that from a tummy procedure.
Now, when you say you are cutting down into the mons pubis region and pulling up with your lower abdominal incision, how far up? Because some patients are nervous that pubic hair will then start growing next to their belly button, and it's not something that is a good thing for them.
That's a great question. That would concern me too, if that was something that was on my mind. The way, obviously, we avoid that is we're actually cutting out most of that skin. So we're bringing tummy skin down. So the hair is not going to come up. You're
not pulling the hair up to the belly button. You're pulling the skin down to the hair.
And that's how we tailor the procedure. Meaning we will then bring the tummy skin down into the mons pubis. Believe it or not, that's what we're doing, and getting rid of that skin so that you're not lifting that skin up onto the tummy.
Right.
That has to be done the right way. You're right. That's how we do it. But you're right. It could be done the wrong way, and you could have mons pubis skin that's with the hair-bearing skin that's too high
above your pant line.
And I don't even do that in my tummy tucks. So in my tummy tucks, regular tummy tucks. Tummy tucks that's non-weight loss, I always go very low onto the mons pubis so that it doesn't get pulled up.
Gotcha.
It is a very good question, and I guess I really don't think about it too much because that's how I address it. I just make sure it doesn't happen.
Right. Okay.
So that's the way you do it.
Okay. Very good. Well, I think that does help answer a lot of questions for a very scary area for some patients to discuss. They don't like to talk a lot of or ask a lot of questions because they just get really nervous. So thank you. I think that was really helpful.
Great. Hopefully that's helpful. Again, it's always part of our discussion. Anytime a patient comes in and we're talking skin removal from the tummy, I'll always address the mons pubis.
Right.
So hopefully they feel comfortable just asking me any question they want to about it.
Okay. Well, thank you.
Great. Thank you.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.